Good afternoon, and thank you for watching our vaccine distribution update. My name is Karen Ayala, and I serve as the Executive Director here at the DuPage County Health Department. As usual, let's start with our goal in mind. Our goal of vaccinating at least 80% of our population, our DuPage population, who are over the age of 18 at this point, would put us at 572,000 residents of DuPage receiving 2 doses of vaccine. As of this week, we have nearly a half of that number, or 279,000 residents who have at least received 1 dose of the vaccine, and over 160,000 individuals and residents who have received both doses and are considered fully vaccinated. This week, we will be receiving 21,000 doses, first doses. Of those, a little over 15,000 will go to our DuPage County partners, while the remainder will be used at our DuPage County community vaccination site located at the DuPage County Complex in Wheaton. We are projecting a base of 10,000 doses next week, almost 11,000, 16,000 doses for the week after that. Now those numbers again are the base, and so we're hoping or anticipating with the news that I'm sure you've all heard that the state of Illinois is expecting at least 1 million doses next week, which would be roughly 40% more than what we received this week. So we're very hopeful, but at this point we're unsure of our doses for the upcoming couple weeks. As we look back over the last 4 weeks, we'll see that our vaccine first doses allocation, our average supply has risen and is up over 19,000 doses per week. Now still, we have quite a bit of distance between our demand and our need for vaccine and our supply of vaccine. So again, this past week, we had 31 providers who requested vaccine, indicating that they could vaccinate over 39,000 residents in that 1 week period. However, we only received 23,000 doses of vaccine from the state last week. So our mismatch in the supply and our capacity continues to be something that not only do we not have any control over, but we anticipate as time goes on and as doses become more available, that we'll get closer together. Right now, who are we vaccinating in DuPage County? We're actually vaccinating all of 1A, all of 1B, and all of 1B+. For those of you who have been watching this vaccine rollout for the last several months, the 1B+ population now consists of everyone who had been considered 1C at the start of this distribution plan. Now the state of Illinois has incorporated all of those individuals into the 1B+ category. So we are working our way through those groups of individuals right now. We did expand this last week to the 1B+ population, which includes individuals who are 16 years old to 64 years old who have chronic health conditions, as well as several other frontline essential worker categories. It's also important to note that as of April 12th, along with the rest of the state, DuPage County will be making individuals of any age, actually age 16 and over, eligible to receive the vaccine. Now clearly, what we've learned over these past months with limited supply is there's a big difference between eligibility for vaccine and actually receiving the vaccine. So we will continue to need to ask for your patience, but know that we are working our way just as quickly as we can to make sure that anyone who wants a vaccine receives a vaccine. Again, I'd like to point out that the Illinois Department of Public Health continues to update their webpage on doses being administered to the population in Illinois on a daily basis. Again, you'll see that overall in DuPage County, there's been a total of 446,108 total doses administered, and we are leading the collar counties with 17.5% of our population being fully immunized. This reflects the information from the report that was published today as of March 30th, which indicates that DuPage continues to lead the way. Also, we are getting a better sense of who is getting immunized, and the charts that are reflected also on the Illinois Department of Public Health Vaccine Administration data page indicate that we have roughly half and half, a little under half of our doses going to individuals who are 65 and over, and still we see a significant difference between the number of women receiving the vaccine and men receiving the vaccine. So that will be a number that and a reflection that we continue to monitor very closely to make sure that we're reaching all sectors of our community. Last week we talked about the individuals who had borne the brunt of both morbidity and mortality, of disease severity and death in our community, being the 65 and older age groups. And we're very pleased to say that as of this week, we now have a little over 77% of our residents who are over the age of 65 have received at least one dose of COVID vaccine. And a little over half of the people in that age category are fully vaccinated. Again, we're pleased with that, but we're not satisfied until we reach out. And we know that there are still individuals in that over 65 category who have not been offered a vaccine. So please, know that we're coming to you, we're going to get to you. Also this week, we're learning more about the state's plan to reopen our state. And it was outlined by Governor Pritzker a couple of weeks ago that although we were then and we continue to be solidly in phase 4 of the reopening plan, that there will be some steps that will help bridge us between phase 4 and being fully open back for business the way we were prior to COVID in phase 5. One of those changes is that gone are the regional metrics. So we will no longer be evaluating our state based on regional performance in any of these categories, but rather we're looking at the state as a whole. So one of the first things that we need to make sure before we can move into this bridge phase is that at least 70% of seniors 65 years and older have received at least one dose of the vaccine. And as of Monday of this week, we see that 68.94, so we're almost to that 70%. However, in addition to that 70% of those individuals being vaccinated, we also need to be mindful of and monitoring the ICU bed availability. We need to be watching our new COVID hospital admissions, and we need to be tracking the total COVID-19 patients who are in the hospital, as well as the unfortunate death rates that continue to be a part of this pandemic. And at the outset of this reopening plan, the governor indicated that we needed to have a steady or declining trend for each of those categories for at least 28 days. Recent information from the governor's office seems to indicate that it might be narrowing a bit, more like 10 days. However, what we see when we look at these other metrics is, in fact, and concerningly, we're seeing an increase in our COVID-19 hospital admissions. We're seeing a slight increase in the number of patients in the hospital as a result of COVID. but gratefully and thankfully, our death rates continue to be low and declining. So we have a little ways to go before we can open up our communities, our county, and our state further. Again, in DuPage County, you have a variety of locations where you can receive the vaccine. We continue to provide doses, and you will see that now our Pfizer doses are nearly 100,000 that have been going out into our community, and our Moderna doses represent roughly 75% of that at 75,800 doses. A reminder that once vaccine supply is more robust, and we're very, very excited for this possibility, we stand ready in DuPage through our partnerships to administer 65,700 doses on a weekly basis through our healthcare systems, temporary community vac sites, federally qualified healthcare centers, and other outpatient primary medical care providers, as well as our pharmacies. So we're very well positioned and ready to take advantage of increased doses coming into our community. In addition, though, we want to make sure that residents who are looking for the vaccine also rely and realize on some of our regional vaccination sites. So we've included this information again. Now again, each of these sites will be open to Illinois residents. You don't need to be a resident of that particular county, but in order to get an appointment, the site has to have vaccine. So it may be that the site, if you check the site one day and there are no appointments available, if you check it again the next day, appointments may be available. So you have to just continually check. And I know that that is a pain. However, that's the reality that we're at right now. This graph once again tracks our progress. We had a slight decrease this week in the number of vaccines that we're receiving. Again, although our projections are significantly lower, we're holding out hope with the news that the state of Illinois will be receiving a substantially increased amount of doses these upcoming weeks. But this is the trend, and this is still that uncertainty and instability of the vaccine availability. We'll continue to target our efforts to make sure that all residents of DuPage receive the vaccine, even the residents who are challenged with additional vulnerabilities or factors such as unemployment or disability or lack of transportation, those kinds of factors. Again, we have opened up our vaccine eligibility to individuals in the previously known as priority groups 1A, 1B, and 1C. Now we refer to them as groups 1A, 1B, and 1B+. We'd encourage you, if you haven't already, to sign up for a vaccine on our website. Also, there is a map and a location finder for vaccine in the state of Illinois. We've included that link on this slide. In addition, if you are not tech savvy, or if you have friends and family who aren't tech savvy and need that extra assistance, or simply want to talk to somebody about either questions or to schedule an appointment, please feel free to call 630-682-7400. Again, we want to remind you, if you have questions or an opportunity to share information and education about the vaccine and the importance of being vaccinated with friends, family members, people in your church or your faith community or your workplace, please avail yourselves of the resources that we have available. Again, watch for our weekly updates in both the news release that we release typically on Wednesday or Thursday, and then our newsletter on Fridays. Once again, I thank you for your time and attention. And if you have questions that you would like to have addressed in upcoming weekly updates, please submit them to the website or to the email address included on this slide. And I thank you for your time and attention. Have a great day.